Hi, I'm Tom Collins, Executive Director of the Arizona Clean Elections Commission, and I'm here today with Tom Betlach, the longtime director of the state's Medicaid program and now a consultant to states and organizations on healthcare issues around the country. Tom is one of the greatest experts on healthcare policy and healthcare in the state of Arizona, and we are really pleased for him to be here today. Tom, thanks for being here.
Thanks for the opportunity, Tom. Good to be with you.
So, the Clean Elections Commission recently did a survey of voters around the state on the issue of, on what issues voters want to hear more about from candidates and what issues they're looking for more information about. And voters on both sides of the aisle identified healthcare as a key issue, a top of mind, sort of top three issue. And within that, there are some other, specific things that they really care about: prescription drugs, access and behavioral health and mental health issues. When we think about healthcare from a voter perspective going into an election, how should people start to understand healthcare policy?
Yeah, that's a great question, Tom. And healthcare is so complicated to start with. And when you think about the policy aspects of it, it gets just as complicated. So understanding what the federal role is in terms of healthcare policy versus the state role, I think is important in terms of voters thinking about the various issues that are front of mind to them around healthcare. So for example, you mentioned prescription drugs. There's really not a lot of levers that state policymakers have around prescription drugs. Really, the vast majority of policymaking around prescription drug costs and how prescription drugs come to market is done at the federal level through Congress. So, recognizing which level of government is involved in the various policymaking is important. You mentioned behavioral health. An important component at the state level is the state Medicaid program access, which you mentioned. It covers now almost 30% of the state's population in terms of enrollment, and as an important part of the overall healthcare ecosystem. And behavioral health is an important part of the access program. So when you think about issues around workforce and access for behavioral health services, particularly children in behavioral health, right? And we've read a lot about the impacts of the pandemic and what it's done in terms of behavioral health needs for the kids population. Access ensures a lot of kids in the state. They're responsible for delivering behavioral health, but they're also responsible for helping, with the overall delivery system and creating the overall infrastructure around supporting things like behavioral health. So understanding which policymakers are involved in which issues and what the levers are from a policy perspective is important.
Sure, I think that makes a lot of sense. The Clean Elections Commission right now, we're hosting our debate series, our legislative debates online. We're working with Arizona PBS on our congressional debates. When we talk about an issue like prescription drugs or access to health care for seniors or people who might be becoming seniors, those are really sort of issues and then obviously we have a Senate race as well. Those are issues really in the congressional Senate decision-making process. Is that right?
Well, to a certain extent, and here's the addition I would make, is that as it relates particularly to things like long-term care and care for people that are aging, oftentimes people feel that's something that's part of their Medicare benefit. And when I think Medicare, I think federal government, and they're responsible for running the Medicare program. But actually, the vast majority of long-term care services are delivered by Medicaid. And in Arizona, that's the access program. So as we think about the aging of the baby boomer population, as we think about the increased need for people wanting services in their home and in their community rather than being in a nursing facility, a lot of that decision-making is actually part of the Medicaid infrastructure, which is run by the states. The federal government helps finance it, so it's important from a federal decision-making perspective in terms of the types of resources that the federal government is helping to share and run the Medicaid program. But how states think about delivering long-term care and home and community-based supports and really supporting individuals in the community, that is very much a state issue, and state policymakers need to be thinking about that, particularly as we look forward in the demographics for not only a state like Arizona, but the national demographics.
Right. So that's they bring up demographics, which I think is a really interesting issue we have in Arizona. We have an incredible amount of growth. The economy in Arizona has been growing significantly, very high in job growth. At the same time, we have a population who might be here longer term that's a little bit older. How do those two things, do those end up as competing issues when you're trying to set health policy, or how do those kind of amplify or work within each other in the system?
Yeah, so I think if you step back, and I'll put my old budget director hat on, which I did for the state for a number of years, it actually becomes a conversation around state resources and what's the allocation of limited state resources, right? So healthcare, and I mentioned that access is now covering close to 30% of the state's population, has grown significantly. And it is a major part of the state's budget. So if you look at the costs of healthcare and how healthcare costs can grow, that oftentimes can then result in more resources needed from the state to fund that growth, which puts pressure on other state priorities like K-12 education, higher education, correctional and public safety, right? So as you think about how a state allocates its resources, knowing that it's financing healthcare through the Medicaid program, thinking about those priorities and how all that gets financed is an important decision. And I think one of the most important decisions that legislators need to make in terms of putting together a budget that reflects the priorities of the state.
So, one of the things that I guess we really have to talk about in terms of healthcare policy because of its impact in the last couple of years and then going forward is COVID. One of the, and I think that, obviously there are issues around, mandates and vaccines and stuff like that are, people have very strong feelings about. But what does the COVID sort of issue decision-making look like for the next governor, next legislature, next senator and Congress people? What are the issues on COVID that they're going to face that maybe we haven't faced yet? Or are we going to see more of the same?
Yeah, so without sort of stepping into all the mandate stuff and the mask issues, but really sort of looking at this from a big picture, COVID's here with us. I think what COVID really revealed is the importance of public health and public health infrastructure and being able to deal with the next pandemic, whatever that is. I mean, it's been 100 years. We were pretty lucky in terms of the length of time between pandemics, but public health is so important in its linkages to prevention, right? When I think public health, I think prevention, and I think how it potentially goes towards other areas, whether that's diabetes prevention or other chronic issues, early childhood, and really looking at opportunities there. So there's important aspects of public health that I think policymakers really should be thinking about what that looks like and how oftentimes what we do in the United States is we fund healthcare, and healthcare is really after people get sick. There's not a heavy investment that's made on the preventative side in the United States, and that's really public health's role. So what is the role of public health? We saw it play out in the pandemic in terms of what the role of public health is, but there's a broader role for public health. And some of those investments, I think, are really key if we're going to look at long-term trajectory for our overall healthcare costs.
Well, thank you very much, Tom, for that insight. That's a lot of information, but I think it really helps to create kind of a map for voters who are trying to evaluate candidates in this context. The Clean Elections Commission will be continuing our legislative and congressional and statewide debate series online and with our partners at Arizona PBS. If you can go to our website, you can check out our survey data, you can watch interviews with Tom and other public policy leaders and experts in the state. You can leave a question for our moderators for our debates. We communicate those questions to them for them to ask the candidates, and so we can get the information that you're looking for as a voter. That's azcleanelections.gov. Thank you again for Tom for being here today.
Good to see you, Tom. Thanks.
Absolutely. And we'll look forward to seeing you all online.